To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Well, today we're going to talk about hip arthritis because I am joined by somebody who knows a lot about that. It's Dr. Lohrbach from Orthopedic Sports Institute of the Fox Valley. Hey, doctor.
Brian, how you doing?
I'm doing great because you're here. So many of us are suffering from some type of hip pain which could lead to hip arthritis. Let's talk about that.
Sure. So hip arthritis is a wearing of the cartilage where our bones come together, the ball and the socket, specifically in the hip joint. Sometimes confusing to patients, is this my hip? Generally speaking, it's going to be in your groin, thigh, and knee area. Symptoms can include loss of motion, pain, of course, difficulty tying your shoes, socks, that sort of thing.
And if I am experiencing any of that, that's why I go to somebody like you. What would be our treatment options?
So once we've determined that you in fact have osteoarthritis of the hip, I'll go over conservative options such as pills, anti-inflammatories, injections, and physical therapy.
Yeah, and that's kind of the easy stuff. And if that works, that's great. But for some of us, that's not going to work. Is that when replacement surgery comes in?
Correct. So I then will enter in discussions with the patient. Is it time for hip replacement? And hip replacement surgery, what we're doing is we're actually replacing the native bone with ceramic materials and titanium to give them smooth bearing surfaces to get rid of that pain that's been so debilitating for them.
Yeah, and you are somebody, 1,700 anterior hip replacements. So maybe for us, tell us what the advantage is and what that is.
Sure. So the anterior hip replacement basically means coming from the front of the hip. It goes between the muscles, so it's more muscle sparing, which is an advantage. It leads to greater hip stability after surgery and also a faster recovery.
Well, let's talk about that. You've done so many of these. In those 1,700 cases, when are people usually up and recovered and walking around?
So interestingly, our patients are doing most of these now outpatient, going home the same day with appropriate care at home. Full recovery is usually within about 6 to 8 weeks, driving within 2 to 3 weeks. And ultimately, I get them back to all the sports they want to do, pickleball, walking, hiking, the things they enjoy. That's the whole idea.
And what do most of your clients and patients say after they've had it? I imagine they're pretty thankful to be able to do those things again.
Yeah, most of them find this to be life-changing, and frankly, they always say, I waited too long. But I understand it's a big decision to have hip replacement surgery.
And so you celebrated 1,700 of these. What is your secret?
Well, I think if you do a good job, people will talk to their neighbors and their friends, and you'll end up with more and more patients.
Yeah,
that's
isn't that
the secret.
Way? Right. Well, Dr. Lohrbach from Orthopedic Sports Institute of the Fox Valley, thank you so much for keeping our hips well in motion, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.